that, ladies and gentlemen, swiftly moving on to another conversation from IVF to menopause. We have with us Dr. Geeta Prakash, family physician, Dr. Jayashree Sundar, gynecologist, and Dr. Tanya Bakshirodgi, director, reproductive medicine, IVF and Onco Fertility, Max Super Specialty Hospital. This conversation will be steered by Ms. Priya Sehgal. I request all our panelists to join us on stage. Dr. Geeta Prakash, Dr. Jayashree Sundar and Dr. Tanya Bakshirodgi. Let's have a huge round of applause for our next session from IVF to menopause. All questions that women want answered.
This is really the answer to all your problems, whichever stage you're in, is here on this stage. So please, I hope you will all listen carefully. And thank you all for taking time out from a very busy schedule, emergency rooms, operating theatres, to come today and talk to us. The topic really is from IVF to menopause, but it's women's health is what we are going to be discussing. We have with us Dr. Tanya. I'll begin with you since you are really the IVF expert here. There is a lot of, I wouldn't say pressure, but there is also a desire for women to conceive when they don't. Fortunately, now there are options, but there is IVF is one such option. But there is a lot of hesitancy. People don't like to talk about it. They're a little worried about the procedure. So if you can just simplify the procedure for us and explain to our audience what it involves, what it entails, and who is eligible for it.
Thank you. And really, many congratulations. Fantastic audience. And I would say kudos to the last team also who spoke about the empowerment of women. And I think we are very much there. And when we talk about myths around IVF, I'd like to say that the perceptions are changing. The women are far more empowered about taking their own decisions. Right from women, I'll simplify it to say, they're coming up and saying they want to freeze their eggs because there's nothing that a woman can't manage. Having a career, being a mum, leading an independent life, and planning a parenthood really when it is right for her. So yes, while the societal pressures do exist, but there is a growing, our younger generation, which is empowered and which is rightly taking the choices in their hands. So typically, if I'd say why women are seeking more fertility treatment, I would say there is a change that we are seeing. Our fertility trends are changing. The age at which they're getting married, they're wanting to have kids, both for men and women, is changing. From the early 20s, it's moving to the late 30s. Again, when we look at the trends, there is a lot of stresses which are there now, hormonal imbalances, lifestyle changes, all of which confound to make really the factor there for a woman's egg reserve, which tends to go down in her mid-30s.
So at the same time, IVF, they don't have to wait for the biological clock. They can freeze their eggs and carry on doing what they want to.
And I think same for men. There is a 50-50. We tend to think that IVF is really because it's a woman's problem. It isn't. When we look at our society at large, our men have equal number of issues with their sperm count. So there could be someone who has a problem with her tubes and she can't conceive. There could be a hormonal balance. She doesn't produce an egg every month and she's gone through many cycles of treatment. But not everybody needs IVF. And I think we need to carefully select who needs it and tailor the treatment. So as we always say, no size fits all.
Okay, on that note. But Dr. Jayashree, you, as one of the country's top-notch gynecologists, I know a lot of people who are very happy that you're here today also. There is the argument for the biological clock also at the end of the day.
I always tell this to patients, and I think it's not a myth, it's a reality, that we are born with a fixed reserve of eggs, whether we like it or we don't like it. So when we get emancipated, our aging ovary is going to age, right? And I think with the stressful life that we lead, which is why now fertility centers are booming in our country. It's not that, so what happens is, as we grow above 35, definitely not only the quantity of eggs go down, it is also the quality of eggs that go down. And this is multiplied when we lead a very stressful lifestyle. Especially now I say the generation is the instant noodle generation. Like you get everything at the click of a button. So people don't know, we allow computers to buffer, we allow our phone to buffer, but we don't allow our body to buffer. And this is more harmful for women, and I'm sure Tanya will agree on that, than for men. So definitely there is a biological clock. That is a reality whether we like it or not. People can do, I have a bit of a different, we are empowered to choose what we want to do when we want to do it. But at the same time, we should not forget there is a biological clock. At 40, you cannot be the same mother as you were at 25, 30. So we should have a realistic expectation about our biological clock. Also, lifestyle is very important. I think the whole country is also talking about it. And the processed foods have to come down. The sleep hygiene has to be maintained for us to do well. Living in a 24/7 world is really not helping a woman's body, definitely. So we have to look at our biological clock.
That is a very important message, I think, coming from you. And Dr. Geeta, you are a GP and someone who sees, I think, all kinds of cases also. In terms, today, for instance, menopause is something I would also be asking Dr. Jayashree about. A lot of people are looking, there is hormone replacement therapy. What would your advice be to women who are towards menopause age?
Menopause, I think, is very important because your whole life changes after this. I always say there are two ways of looking at it. Either you feel that, oh, I've lost my femininity, I'm no longer woman, I'm no longer the sexy creature I used to be. But they don't realize it's also freedom. That's one way of looking at it. You can go where you want, you can travel where you want, you don't have to worry, mandir jana hai to hamara period aayega to kya hoga. Things like that. So I think it's a lot to do with your mindset. Also, like you said, menopause is important because you can have all kinds. You can have a surgical menopause, which happens early, in which case you would probably require HRT. Or it could be early menopause. Again, you need HRT, maybe. Like they said, the gynecologist, this is very important. You should select the kind of person that you are getting. Because if you just sort of do a broad kind of a lookout and say, oh, this one probably needs HRT, isko to de do. You have to assess each person. So I think you have to look at the whole lifestyle. Like she said, you have to see that they are, the right candidates for it. And also, when you have too much bleeding or you need to make a medical kind of a menopause, you have to stop their, period because of any reason, then you may need to do some HRT kind of thing. But otherwise, I think you should, by and large, let the body take its toll. I think that is what is a better way to do it.
Okay, we have Dr. Anjila Aneja, who's come with a great sense of timing, I must say, because she is someone who has argued in favor of HRT on my show earlier.
Absolutely.
Would you like to come in on the conversation?
The first thing is that most women or the family thinks hormones are bad and they cause a cancer.
What exactly is HRT? Can you explain to us?
We call it a menopausal hormone therapy. That is a woman who is a menopausal or a perimenopausal age group who is suffering from the symptoms or at risk of bone loss, or she is suffering from loss of libido, painful sex. They are the people who are the right candidate. And this is called menopausal hormone replacement therapy. We called hormone replacement therapy in a woman who get a premature ovarian insufficiency. Means they stop their periods before the age of 40 years. There, it's a replacement. Yeah, and it's not bad, it's very good. It improves the quality of life, it takes care of your heart, it takes care of your bones, it takes care of your hot flashes, your mood swings, and this improves your sex drive and takes care of even the painful sex. So, what happened many years ago, there's one study which came in and this all went down the hill. Now from last 10, 15 years, we are actually re-educating ourselves, and all the guidelines, Indian guidelines and international guidelines, they are in the favor. And the risk of cancer is almost rare if you have investigated a woman proper and you have counseled her well, she comes for a regular checkup. If she takes for 5 years, it's hardly there. You know, if it's there, if it happens, you know, the other causes, if you look into the obesity, it increases your cancer risk by 8 times more. Alcohol, smoking, it increases your risk of breast cancer by 8 times. Then why are you worried about hormone replacement therapy, which improves your quality of life, which even decreases your morbidity. You know, the morbidity after falling and having a fracture of your femur, it takes a toll on your health and increases your mortality. Why a woman is scared of taking a hormone replacement therapy?
I think there are too many myths that are involved.
There are lots. The one myth is कि मुझे cancer हो जाएगा. Second myth is कि hormone नहीं लेंगे हम. You know?
The hormone nahi lena is an argument I've heard, Dr. Jayashree. Yes. What would you advise?
So if there is a need, it should definitely be given. As Dr. Anjila pointed out, if somebody suffers a premature ovarian failure, that is you become menopausal before 40, which is happening more commonly now, definitely that woman would need an HRT. It is not just it is her reproductive, not only her reproductive health, it is also her cardiovascular health, her bone health, as she said, her cognitive health. That also goes for a toss if you go low on estrogen very early on in life. After the age of 50, we should be able to choose carefully the woman we want to give HRT, because the studies that were done showed there was a morbidity, but the woman chosen were the wrong population. So if a woman needs it urgently for a purpose, it can be given under supervision, as Dr. Anjila rightly said. But if it is a premature ovarian failure, these poor women should get their HRT, because their reproductive health is going to go for a toss. Their, they might have fractures at just the drop. I mean, even falling down very simply can lead to fractures, and you don't want them to have this. So I would vouch for HRT in the rightly selected population, definitely.
Thank you. And you know what, I just want to add, the woman who has a premature insufficiency, means who stops their periods before 40 years, their lifespan decreases. So it's meaning the chances of dying are more in a young woman. So it's very important, the take-home message is, it's very important you take it properly. It affects a toll on your mental health, your physical health. And see, once you give a hormone replacement therapy, they are so happy and their life is so beautiful. And now just, can a hypertension patient can take it? Why not? Can a diabetic patient take? Why not? It improves your cholesterol, it decreases your cholesterol, increases your good cholesterol, decreases the bad cholesterol, even your blood sugars, insulin resistance becomes less. It's a very good thing. And I think that Tanya can tell about even the fertility, what happens.
I was going to bring Dr. Tanya on this one.
I just want to add on to that, even though I'm the fertility person here, but hand on heart, how many women here in the audience get their regular PAPs? How many women have had their regular PAPs? I would want every woman's hand up. And I can see barely handful. So we have to empower ourselves to do our regular screening as well. Go to specialists who are aware of the facts, who are able to regulate the way your hormones are given as well. So rightly, we've got the team who've said the right candidate for the right treatment and for the right method for a follow-up. Often, when we were abroad, we have a system of a call and a recall, which means if today I need a pap smear, I would be given a letter and I would be given a call from the GP's office to say regularly, okay, first letter to say, you due, then another reminder. Often we forget. But I think the first part of women empowerment is also that we make sure that we are important and we're looking after ourselves. We're looking after our own health, be it our sleep, be it our weight, be it our screening. Sometimes there's also a fear of screening. So when we talk about hormones, we talk about cancer, I would say even fertility treatment, sometimes people are scared that I'm going to have so many hormones, so many injections, and the biggest fear is cancer because there are so many myths around it. Each of us sitting here are different. Each of us has a different biological clock. Each of us has a different age of menopause. Each of us has a different risk. Cancer being just one of them. Even a risk of developing a clot. So many of us take the contraceptive pill and we don't think about it that much. But when it comes to, the perimenopause or the menopause, we really think hard about all the negativity that can happen. So I think the first thing is we need to know our facts. We need to know our own body, need to know our own health, and then take whichever medication will suit us the best. Really, I think bad fears are worse than bad medicine.
Well said. And we should not be afraid to ask and look after your own body at the end of the day. You're looking after the entire house. So begin with your own self first. So Dr. Jayashree, in terms of checkups, what are the ones that, I know there's no one size fits all, but on an annual level, what should one, look for? And as you head towards the menopause age, do these increase?
So all women from the age of 25, I mean youngsters should go for their cervical cancer vaccination. If you have daughters at home between the age of 9-25, when they are sexually naive, that is the best time to vaccinate them. So that is the first thing that should be a take-home lesson for all the youngsters. In fact, we are now vaccinating the boys also. We have vaccines to vaccinate the boys. Number 2 is there should be an education at home. One about your menstrual cycles, how to maintain your menstrual hygiene. So there's no need to take a youngster to a doctor, but I think there should be an awareness about how to deal with their menstrual cycles, and menstrual hygiene is very important. There are a lot of youngsters who want to use the menstrual cups because they are becoming very environmental conscious about the sanitary fills that we are all creating, right? So I think we can talk to those people about that. So school, it is very important to educate school-going children. For adults, it should be always at least 3 yearly screening of pap smears, and if there is any menstrual irregularity or any discharge or any pain that is very different. I see women coming with a 20-week sized or a 10 centimeter fibroids coming in saying that aise lag raha tha that I was feeling something was heavy there, I thought I was becoming fat. That should not be the approach to your health. The approach should be that you should know how to deal with your body and work on it. And work is important, but it's also important to take care of ourselves. And any different symptom, you meet the doctor. Otherwise, it should be a 3-yearly approach for youngsters. For older people, if they have any history above 40, it should be the mammographies or ultrasounds, pap smears, and also cancer screening if there's a strong family history of cancers, I feel. I mean, that should be the approach for women.
Okay, thank you. But Dr. Geeta, I saw you shaking your head at HRT. What is your main worry and what is your suggestion for menopausal symptoms?
You know what happens is that a lot of women come and say, हमको HRT करना है, पर हमको समझ नहीं है कैसे करना है. So you send them to the gynecologist and say, you go and meet so-and-so and try and get it all sort of sorted out in your head.
You have 2 names on the panel now, you can suggest them too.
The problem becomes that they will go there and come back and say, but उन्होंने वो तो हमको बताया नहीं, पर हमारा तो, sometimes they don't give a full history. You will always ask, do they have a cancer history in the family? Because we are a little more careful in those patients. They may not give it. Also, I see a lot of the people from the villages who have no clue. So that is what they say, कोई गोली लगाते हैं, कोई हमको इंजेक्शन लगा देते हैं, पता नहीं क्या होता है, हम कहीं मर तो नहीं जाएंगे. That is what I'm saying. So it's just, I think awareness at all the different levels is what is important before you start an HRT. See, the upper level of society, everybody knows about it, you talk about it, you could discuss it maybe with your friends. But most people are unaware of it, remember that. That's why I always feel that like I said, I run this clinic at home, which, all this help come to me and the gardeners and their wives and whatever. So they want to know कि हमारा तो बंद हो गया, 35 में बंद हो गया, अब हम क्या करें? So you say you go and meet a gynecologist, but they cannot explain or everything that they want to, or they are too embarrassed to talk about it, which is why I think HRT is a very sort of a hazy thing in their lives. Whereas for most people, of course, you can talk about it and get to know everything about it. But you have to select them carefully. Like she said, if it's an early menopause, it's a surgical menopause, any of these, definitely. But the others, I think you have to educate them before you can think of doing anything. That's the only thing which comes to my mind.
I think it's a simple thing to say कि आपके hormones खत्म हो गए, उनको replace करेंगे तो आप ठीक हो जाओगे.
But they say कि हमारा तो वैसे दादी का भी हुआ था, नानी का भी हुआ था, हम क्यों दवाई लें?
I think, it's a counseling which matters.
Exactly. So we just need to do that first.
So everybody should counsel in a way not to scare someone.
They get frightened by the fact that रोज गोली खाना पड़ेगा. You know, it's not like a blood pressure भी नहीं है हमको, हमारा वो भी ठीक है, sugar भी ठीक है, फिर आप बोल रहे हो ये वाला गोली खाओ ये वाला. So they take a lot of doing.
Dr. Anjila के पास भेज दो, मान जाएंगे.
I send it to you.
I think the way we are dealing with menopause is also changing. Like I'll tell you, when I looked at my mother undergoing menopause, when she was 50, I got married when she was 50, and I have never seen her complaining about any menopausal symptoms. So I always now in retrospect look back and think, why was she not complaining? Why are women now complaining more?
उस समय चुप करने की आदत थी और बात नहीं.
So I think the other thing was they had more of community-based living, and we live in a very socially structured living. You know, that is, I mean, we are different from what we are. I think, I mean, it's very difficult to explain, but I think they had this, you know, community. They would just sit and do knitting or keep chatting. The support system was more community-based. I think that really helped them with their menopause more, because I'm sure they had all the symptoms. My mother-in-law had every bone fractured, but still she would bend halfway down to do her rangolis, you know. So I think we need to look at that aspect also, about creating that social network or community network for women, which really helps them to deal with menopause.
You know, at least women menopause is understood and talked about. What do we do about male menopause? We won't even admit it. And they are going through all these grumpy, angry.
Absolutely. And I think as a mother of 2 boys and a husband who I keep saying is in andropause as well, and I keep telling them, just like I have hormones, so does your dad. It's not that every bad mood swing I have, it's, oh, mummy's either in the perimenopause or menopause. I said, so does dad. And really, it's beyond that. The cardiac protection for men is real. The bone protection for men is real as well. And just like we think, and we only talk estrogen, there's testosterone out there, guys. Absolutely. And there is stuff that you can get. But whatever you take, make sure that you're supervised, make sure you're getting your checkups. And I'd like to add to what Dr. Jayashree is saying, that yes, we had fantastic community support, and also the nutrition was different. There was diet. Even today, I have my great-grandmother at 96, and sometimes she'll say, ye khao to ye better hai, desi ghee aisa better hai, and we've gone round the world and come back and said, nothing like home food, nothing like the nutritious food that was made by our dadis and our nannies.
It was all organic.
It was all organic.
All organic.
गोंद के लड्डू, pregnancy में हम कहते हैं calcium है. आज you ask the younger generation, आपको पता है nuts में कितना calcium है, green veggies में कितना है.
No clue.
So we need to even work on the diet. Our exercise, they were so active. Half of them would be working till the end, and they would be doing their pocha squatting. Awesome for your body, awesome for your pelvis. We are teaching you pelvic exercises now. They knew it. So I think something to look back, take the best that we can from our elders, put it into perspective of what we know from the latest, from the younger generation. And I think the best is if we can gather all the generations together and get the best learning.
True.
And have conversations like this in the open. You know, earlier on, I think part of the reason was they were maybe behind closed doors amongst communities. But now we can at least talk about these issues across genders, across divides, and there are solutions right here on the stage. So big round of applause for our panelists here. And thank you so much for this conversation.
So much to all of our panelists for that extremely important conversation. As a cancer survivor myself, I must tell everyone that, you know, screening is much better than not being alive. So don't be afraid of doctors. Don't be afraid of going to the hospitals and getting yourself checked, because that's the reason I'm here today. That's the reason some of us will be here tomorrow as well. So thank you so much to all our doctors for doing the work that they do.